How do you handle therapy clients who barely have any bodily awareness? Hi, I'm a somatic therapist, Isabel with a Y. This is what I do for my clients that have difficulty. One, help them learn how to. I always start off every new client building the foundation of this. And how do they learn this? Give them words to start being able to identify what are they feeling in their body. So I give them a worksheet, a couple of worksheets, and they can start using words that describe what is going on internally, whether it's something like temperature, weight, size. There are so many different ways to conceptualize what you feel internally. Sometimes it can be hard to put it into words, and so I let clients be as abstract as they like. Is there a movie? Is there a song? Is there an image, a smell, a color? Is there just something that makes sense to you and how you feel? This is a skill that you build just like exercising. You're not going to start by lifting 50 pounds. Unless it's something that you become accustomed to, something that you're comfortable with, something that you've worked on already. You start off really small, and that's okay. There are a lot of exercises out there that can really help somebody connect with what's happening internally. A really fast and quick one is while you're in a session with a client, spend 15 to 30 seconds running in place, and then after that, sit down and notice everything that's happening internally. Your heart is racing, your face is hot, your hands are warm, your feet feel light. All of those little nitty-gritty details of what's happening internally, they can start to name those things out. Literally from head to toe, what is happening in your body. Sometimes it can be concerning or difficult to know what to do if a client says that they don't feel anything. I feel nothing. Well, we can work with that. What does nothing feel like to you? Does it feel empty? Does it feel heavy? Does it feel numb? Using the words that they start to take from the different worksheets or as they start to conceptualize, those are the words that they can start using to describe what does nothing feel like to them. If all else fails, you can ask them, where does it start? Where does it end? That is a way to start to notice, is this something that is full body? Is it something that's just in your chest? Whatever it might be for them. One little part that can be really helpful is parts work. You can dip your toes in that a little bit and start to separate it from them and say, is there a part of you that is feeling anxious? Is there a part of you that's feeling numb or empty? Is there a part of you that's feeling nothing? And then they can start to externalize it and potentially start to notice more things now that they're separating it from themselves a little bit. Lastly, do not force anything. If a client is not connecting with something, you don't have to keep doing it with them. And I find it really helpful to check in with them and ask them a couple of questions throughout anything that we ever do in therapy, just to see if it's even helpful for them. After we do an exercise, it could be something as simple as saying, how connected or disconnected did you feel to what we just did right now? And then leave it up to them to decide what that means or what it felt like to them. Another question could be, what's coming up after that? And they could share anything that's on their mind or anything internally that they're feeling. And then of course the big questions, is that something that you found useful or not?